Hi, this is Tom Oding at the University of Iowa. I'm going to show you an interesting case where we didn't control the chamber while we were doing an anterior vitrectomy. You can see that we've got a large circular posterior capsular tear here, but we do have an intact anterior capsule. We have placed some viscoelastic in the eye, but we decided to check to see if there's any residual vitreous using a Weck-Cel initially, and then with preserved dilute Kenalog. You can see that the Kenalog is not going in very well because of the residual viscoelastic. And so here we're using the anterior vitrectomy instrument to remove some of the OVD. However, we don't have good control of the chamber because we're using the large incision that we made for the phaco needle for the small, thin anterior vitrectomy instrument. And as a result, fluid is pouring out around the sides. Here you can see as we place this preservative-free dilute Kenalog that we don't see any stained material at this point. There's still some pockets of OVD, so we decided to go in and once again have the fluid pouring out of the wound as we remove the residual viscoelastic material. And as a result of this very poor control of the chamber, eventually the vitreous does come out around the wound. If we would have had good control, I don't think this would have occurred. We can see this now as we stain with the Kenalog, how eventually we did encourage the vitreous to come right up to the wound, which is exactly what we didn't want to happen. The Kenalog stain nicely clothes the vitreous and shows the outside aspects of the vitreous, or the outermost aspects of the vitreous. And here we're using the anterior vitrectomy instrument, and we have a tough time because we are trying to get underneath the cutter to do this. It would be better probably at this point to use the paracentesis for the cutter in order to get a better angle at this material. Eventually we transition to the Weck-Cels to get the residual bit of stained vitreous material. So the important lesson here is to close the chamber, to use a separate paracentesis for the anterior vitrectomy instrument so you have good control of the chamber. This is Tom Oding at the University of Iowa. Thank you very much.